Hello everyone, my name is Dr. Chris Bowman. I am a pediatric and family chiropractor, and I help families experience optimal health and wellness so that they can make happy memories together as a family. One question and one concept that I've been talking a lot about with my pregnant ladies, especially ones that are due relatively quickly within the next month or so, is your birth plan. Okay, this is super important to make sure that you have written down and other people are aware of it, such as your doula or your midwife or your partner. And the reason why is because if you're birthing in the hospital, there's going to be things that are routine insurance, standard of care procedures that they will go ahead and do unless you tell them not to. And I don't care, well, I do care, but I don't have a say on whether you choose to do them or not. But if you choose to do them, that's just it. I want it to be your choice. So the top 4 or 5 things that is going to happen if you are having a hospital birth, let's say you deliver, a healthy vaginal birth, no complications or anything like that, on a wellness baby, what they're going to want to do is the Hep B vaccine right away. Well, maybe not right away, but definitely before you leave the hospital. Hep B is only transmitted, that's the word I'm looking for, through basically dirty needles and bodily fluids. So unless you plan on your newborn doing drugs or being promiscuous, the chances of a baby developing Hep B are not very high, so you can make that decision on yourself. The next one is vitamin K, okay? Another injection that they'll do. Unfortunately, the vitamin K isn't just vitamin K. There's preservatives and those type of things in there. And it's also delivered via, injection. So there is that bit of emotional trauma associated with that. And there are other alternatives to delivering vitamin K. If you want to do oral, they have an emulsified vitamin K that works. But also considering if you're having a boy and they're going to be circumcised, so that's another question that you definitely want to ask, research, and come to a conclusion before the baby comes. But if you have a boy and getting circumcised, vitamin K, might be, I might be more keen on giving my baby the vitamin K, probably emulsified oral version. But if you're having a girl and there's going to be no cutting or bleeding, then you might want to question if the vitamin K is going to be right for you. The third thing is cord clamping. Okay, this is super important. And I think the statistic, I'll make a comment later on if it's not right, but I think it's something like when the baby is born, 1/3 of the blood is still in the placenta. 1/3 of the baby's blood is still in the placenta. So if we're clamping that thing right away, that's a lot of the baby's blood that it has to make up for. So we want to make sure that we have delayed cord clamping at least 10-15 minutes until there's no pulse in the cord before it's clamped and cut. Okay. I think those are the big things that I wanted to hit: the Hep B, the vitamin K, circumcision, and cord clamping. There's also a heel prick that they're going to want to do to check for any disease, basically like a wellness check, so you can decide if you want that done or not. So before you go to the hospital and deliver your baby, have decisions on those things, so that way it's your birth your way, not the doctor's birth their way. Have a wonderful day.